Good afternoon, everybody. First, we'd like to thank you all for participating in today's open mic webinar. We're going to go over a few things first. Our next month's webinar will be on August 20th, and it is the Warm Handoff, the Hospital Skilled Nursing Facility. There is a Q&A section at the bottom of your screen, so if you have any questions for Paula, please make sure to put your questions in there and she'll get them answered for you. Paula is a clinical process improvement manager at the Montana Primary Care Association. The MPCA is an association of 18 community health centers or federally qualified health centers. Paula provides training, technical assistance, and coaching to primary care practices in quality improvement, risk management, and patient-centered medical home transformation. Paula can help a clinic access, strategize, and implement change to improve clinic systems. She has experience helping centers achieve patient-centered medical home recognition, Joint Commission accreditation, and meeting HRSA Community Health Center requirements and expectations. She leads peer networks of medical directors, dental directors, clinic quality leaders, and behavioral health integration staff and clinical pharmacists. We're glad she is here with us today, and we'll hand everything over to you, Paula.
Thank you. All of our community health centers in our state are working on patient-centered medical home transformation, and about 3/4 of them have status as being recognized. I understand this group has a telehealth focus, so I will try to weave in things that are telehealth related, but forgive me, you are the experts in this area. And I would like to ask, I don't know you, and it makes it hard to chat when I don't know you, but if you could just put in the chat box any experience you have with patient-centered medical home. Maybe you work in a clinic or institution that has this recognition. It would help me to know what people know and what people don't know. So this is an overview of what I'm going to talk about today. First of all, patient-centered medical home is really not a new concept. It started in pediatrics, where it was discovered that high-need, very complex diagnosis children had better outcomes when a team worked with the family and the child. A team was focused on all the care that the child needed, on the outside specialty care that was needed, outside referrals, and worked very hard to coordinate this care. So they started it, and it has evolved today, and you can see the definition here. I need to speak louder. Let's see here. Is my speaking loud enough now? I need to know. So please let me know if you cannot hear me. The definition, just very faint as if on speaker. Okay. Okay, I've turned up my volume. Let me know if this is working. Okay, patient-centered medical home has evolved today to the definition that's on your screen, where the patient is the focal point of the model, the care is built around this, and the care is provided by a team. I will let you read the rest of that definition. So, why become a patient-centered medical home? Well, I want to take you back to this book that came out a few years ago, Crossing the Quality Chasm. You can get this online. It's probably, in my mind, one of the most important ever quality publications. It talked about our health system right now and all of the problems that we were having. It pointed out poor care, our poor coordination of care, how poor our outcomes were compared with the world. And then it had several suggestions for improving healthcare. And these suggestions are listed on the slide. So if you think about your own life, your own family, your own experiences with medical care, it's probably sad, but I think most of you can come up with experiences where these components are not present. We don't always see continuous relationships. My father has very complex care needs, and my mother is always seeking to make sure the doctor knows what the specialty providers have advised. And this has been going on for several years. And he actually is in a patient-centered medical home now, but it's a transformation journey. We're not there yet. The patient care needs to be on the patient's values and needs. Patients want to be in control. Patients need information to make decisions. Almost always, when there's a decision to be made, there's 2 or 3 choices, not just one choice. So the patient has the right to have this information. Evidence-based care, it is surprising how much care we provide that is not based on the latest evidence. Patient safety is pretty obvious. Our costs are high. We need to decrease waste and cooperation. So I told you some of the components of patient-centered medical home. These are several of the theories that are behind patient-centered medical home. And I'm not going to go into this today because I know we have only an hour. But the chronic care model has been around for many years. It's a beautiful model involving the patient, the community, and all of the health centers or health systems. Patient-centered care is a concept that's been around. Cultural competence is another concept that is becoming more and more politically correct and important in providing care. And then medical home is another concept that is out there. So all of these concepts have evolved to what we call patient-centered medical home. Okay, this next slide, the joint principles of Pcmh. These principles were developed back in 2007 by 4 major physician groups. It's my favorite slide because it shows that these 4 groups, who often would never agree completely, did sit down and come up with these joint principles of patient-centered medical home. So note the dog and the cat. Maybe your dog and cat would pose like this, but the one at my house, the 2 at our house would never sit side by side in loving companionship.